Welcome back again to our series of interviews with Babette Rothschild, talking about her new book, 8 Keys to Trauma Recovery. Babette, we're going to be talking about the key that you've called Get Moving. What's this got to do with recovery from trauma?
Well, there's actually several things that are important about getting moving for someone who's suffering from trauma. One is that we know, and it's well documented, that exercise helps reduce stress. Firefighters, police, CEOs of companies will tell you that exercise helps them reduce their stress in many ways. So PTSD, post-traumatic stress, is a kind of stress. Moving will help. So that's one. Another is that a lot of people, as we've discussed before, as one of the survival options for the mind and body in dealing with trauma is to freeze. And since people who are suffering with post-traumatic stress, their body and mind will sometimes feel as if it's frozen again, or in that flashback phenomenon that we talked about before, they will actually freeze in a misperception that the trauma continues to happen. The fact of just moving can help send a nonverbal message that they're no longer frozen, that the trauma is no longer happening. And thirdly, anything people with trauma can do to increase their muscle tone will help facilitate their ability to contain the stress that they're dealing with as they're learning to dissipate it.
Okay, thank you. I imagine that it would be important for somebody who is applying this key to their trauma recovery to also bear in mind some of the other things that we've talked about, the earlier keys like mindfulness to see what's good for them, and also what we were talking about quite recently, this idea of taking small steps.
Absolutely. I think actually that's both of those are important in application of any of the keys or any other method or strategy for trauma recovery. That applying their mindful gauge so that they can evaluate if something's going to be and or is useful for them or not. Is it something they should do more of or stop doing? Is extremely important. And also to, in anything that they attempt, to reduce the step size to something that they can manage successfully.
Okay, could you give some examples of ways in which people have found this getting active, physically active and involved, has been beneficial to them?
Yes, and it's not even in the way you say active. It's not that we're sending people out to run marathons and such, but to just increase their activity enough and in slow steps so that they can help facilitate themselves out of that feeling of frozen trauma. In fact, one of the things that someone who's interested in getting moving, in having some kind of exercise, increasing muscle tone, etc., needs to be alert for is that often aerobic exercise is contraindicated for people with PTSD. And the reason for that is that in aerobic exercise, the nature of it is to increase heart rate and increase respiration. And for many people with PTSD, that can actually trigger a somatic and or visual auditory flashback, because increased heart rate and respiration are often features of the traumatic stress response, what happened in their body when they experienced trauma in the first place. So for some of them, any kind of exercise that artificially increases heart rate and respiration could trigger reminders of the trauma, and that wouldn't be a good idea. So sometimes the idea of getting moving has to do with doing things that are more low-key, even just going out and taking a walk, or doing some kinds of weight training that don't involve pushing respiration. So a little bit of wall push-ups, or a little bit of knee bends, or a little bit of lifting milk milk cartons, for example, slow enough that they can increase muscle, but without needing to increase their respiration and heart rate.
And does that apply to everybody? I mean, I believe you sometimes recommended people to do things like self-defense classes and so on. So.
Nothing applies to everybody.
All right.
Nothing applies to everybody. And maybe that needs to be stressed again, particularly with this key, but it applies to all the keys. There is nothing in the strategies I'm offering people, in the strategies that anybody else is offering people, that apply to everybody. And so the point of using the mindful gauge and of taking smaller steps is for people to find out really what suits them. And this is a good example of that. Yes, for some people, self-defense training will be very valuable at some point. It may not be at the beginning point. It may not be at the middle point. It may not be at the end point. It may be, someplace quite individual to themselves. And the same with any of these things that we're talking about, whether it's walking or weight training, or if somebody does benefit from aerobic exercise without suffering flashback, jogging or swimming, etc. Absolutely individual.
Okay. Thanks very much for that.